It can empower the care staff.
Right across our board, we're making a really big change here with a really simple tool. We were seeing an increased amount of people, unfortunately, going into hospital from ambulance conveyance from care homes with falls. Falls is one of the highest reasons for being conveyed into hospital.
On many occasions, care staff were reticent to even attempt to pick up someone from the floor, fearing that they had other injuries and it might cause more damage. So there was a high rate of 111 calls, ambulance call-outs for a lot of the falls in care homes.
So before we had the Razor 2 and HelpFall would just purely be a judgment call, but then it would result more than likely in a 999 call.
We would have to use a hoist, which was incredibly undignified. It would be phoning the paramedics and going through the checklist with them, or the senior carer on shift, using their training, but it would mostly probably be guesswork.
Having that amount of ambulance call-out, 111 call-outs, where a lot were not requiring transportation to hospital, was a real pull on resources. It meant a long time for people to be laying on the floor as waiting for a non-urgent ambulance to come and assist them off of the floor, and that can create other problems. You could have cold, pressure injuries, uncomfortable, distressing, so then people having long lies on the floor waiting for ambulances to come. And that's something we set out to try and reduce.
So it's really important that we do as much work as possible to reduce the stress on the ambulance service so that they can respond to the people that really need it at the time they really need it. So we received some national funding from NHS England on a recurrent basis to support the Ageing Well policies within the North East Essex and Suffolk area.
So the Razor and HelpFall project was to address and support people in care homes who are suffering falls and monitoring the falls, trying to use IT as a way of supporting care homes to support their residents better and more comfortably.
The reason that we chose HelpFall to roll out across our system was because A, it's really simple and easy to use. The QR code is actually on the Razor chair that the carer is about to actually use. Secondly, the questioning was worded in a really, again, simplified way that makes sense for the person who's actually conducting the assessment of the patient. So the report that actually goes back to the provider, giving very clear guidance on what decisions were made during that process, following of course the NICE guidelines, and now it's that so what element. So even though you've done that assessment, yes, someone may be hurt and it may not be safe to pick that person up, but do you have to call 999? Maybe not. And where it gives the information about the UCR services so that they can respond in an urgent community response way, then that really helps support our system moving forward.
The HelpFall app is simple, it's quick, it's for any grade of care staff that could use it. It doesn't have to be a nurse, it's for everybody to use. So we contacted the 20 care homes, we explained the project. With the Enhanced Health in Care Homes framework, they now have to, or they're now encouraged to look at IT to support residents in the care homes. So we did explain all this to them, that it would hit a lot of these markers. It was the way forward to try and pilot these things and see if it did support and help assist their residents.
So they came out and they showed us how to use it. I think the staff were a bit scared at first because it's new, but myself and the manager Trudy, we sort of took control, and when there was a fall we got it out and we're like, this is how you use it, and then they just sort of ran away with it, really.
Since we've had the Razor chair, we have had a few times where we've had to use it. We've had a time where a lady was basically her legs had given way and she needed to be lowered to the floor. I did use HelpFall to obviously ensure that I was doing the right thing before manoeuvring the lady. By going through all the checks, I noticed that it was okay for me to stand her. So we used the Razor 2 to stand, and then obviously we transferred from the Razor to her chair. But yeah, and then I filled out the report and sent that over to our email.
Belgains have been making contact frequently with care homes to support them through it and see if they're using it, how they're getting on with it and things like that. So I've been going in and sort of troubleshooting if there was any problems or advice and feedback, collecting feedback from care homes. I have to say the majority of it has been positive. So the project with the Razor chair and the HelpFall has reduced, in those pilot care homes, has been shown to reduce the amount of ambulance call-outs and 111 calls. It can empower the care staff. They don't have to rely on other resources, other services. They've got that app and that will give them the green light, or otherwise it will tell them if they need to call an ambulance. It will tell them if they can assist using the Razor chair and assist that person from the floor.
They're more confident in handling a fall. They can just get the HelpFall and they can follow the instructions. It's almost like there's a little bit of pressure that's been released from them of, do you know what, this is telling me what I should do. I don't have to guess anymore. So yeah, definitely a benefit.
It is helpful. It is really good, and it takes a lot of stress off of us. Obviously the HelpFall gives us that little bit more reassurance when it comes to our decision of moving.
I was on the floor and the girls got the Razor chair and connected me up on it on the floor and literally stood me up. Didn't have to pull me or lift me or lug me anything, drag me anything, and put me in the chair. It was brilliant. Very efficient and painless.
We've seen an 84% reduction in ambulance call-outs to care homes that have been using this HelpFall app with the Razor chair, which is a phenomenal achievement so far. But also, really importantly, there's been a reduction in the no abnormality conveyance rate. So no abnormality conveyances are generally for people that have been taken into the emergency department to be checked over and sent home with possibly nothing more than a letter to their GP just to say that that person has fallen. And that has reduced from 27% to 0% for these care homes using the HelpFall app. So that really does save a huge amount of time, not only for the crews and the conveyancing, those people at the front door of hospital, then all the discharge team. This is a huge process that takes a lot of time and logistics. So on top of that, the benefit for the patient is they've not had to go into hospital, they've been able to stay at their home. We've also seen an 80% reduction in the amount of ED attendances for care homes for falls with the ones using this particular system. So right across our board, we're making a really big change here with a really simple tool.
I personally would like to see the HelpFall app used in all care homes. We'd have overall district insight using that data and that monitoring. So we'd be able to identify high fall areas. We'd be able to put in further support and resources to support sort of bespoke training or equipment for particular care homes.
I think every care home should have one, to be honest. It's more dignified. It's just so much more helpful. Somebody has a fall, you don't worry and then have to waste time by phoning the paramedics of what do I do. You've got it right there, and then you can help this person up. And it's just a quicker process and it's safer.
So we're really trying to figure out now as a system how we roll things out in the best way, using the funds appropriately for our community. And I think the HelpFall app, being available to all of our care homes across not only Suffolk but North East Essex as well, will really enable a short, sweet, simple decision-making process that will hopefully reduce the amount of people being conveyed to hospital. So it's a very simple thing that could have quite a significant impact on our system.